Thank you, Madam Speaker, and I'm pleased to rise today to update the Assembly about the Canberra Hospital Expansion Project. Since my last ministerial statement to the Assembly on this project in February 2021, the $624 million Canberra Hospital Expansion Project has dramatically transformed the Canberra Hospital campus. The Enabling Works program to relocate services around the campus in preparation for the new Critical Services building has now been fully delivered. The Enabling Works alone have supported about 100 local jobs, with Canberrans joining teams that have delivered the construction phase of the Enabling Works that have provided some great new facilities for the immediate benefit of hospital users and staff. By far the biggest project in the Enabling Works program was the completion of a new Building 8 in June 2021. The opening of Building 8 was an important milestone for the Canberra Hospital Expansion Project and has provided fantastic new facilities for the Canberra community and health service staff. Building 8 houses the Canberra Sexual Health Centre, which was relocated to the modern purpose-built clinic on level 4 of the new building. The relocation of the Canberra Sexual Health Centre has supported the work of providing sexual health services for priority populations with a focus on prevention, screening, early diagnosis and treatment of sexually transmissible infections and HIV. Building 8 also includes new teaching and training facilities for the hospital, including accommodation for the ANU Medical School and University of Canberra. This provides an opportunity to house important research units with education together on the one floor, encouraging increased collaboration. The co-location of education and research means we can measure training effectiveness and provide the community with the assurance that Canberra Health Services staff are accessing the best evidence-based education to enable exceptional person-centred care. The new Surgical Skills Centre was also a purposely designed and built facility within Building 8. The area encompasses private study space, tutorial rooms and 2 clinical skills laboratories, one of which is equipped to handle wet specimens and tissue. During the Enabling Works phase, we also delivered a new Child at Risk Health Unit that is ensuring this crucial work with some of Canberra's most vulnerable children can continue in new fit-for-purpose facilities at the Canberra Hospital. The Canberra Hospital Expansion Project also undertook refurbishments to Building 4, including a new library, teaching and training spaces, and refurbished Building 9 to provide new accommodation facilities for patients and carers. The 12 apartments that were refurbished in Building 9 make available short-term accommodation at the Canberra Hospital for interstate patients and carers. In August 2021, a new temporary car park opened at the former CIT Woden site. The space provides parking for both hospital staff and Canberra Hospital Expansion construction contractors. In total, it provides more than 1,100 spaces and has freed up parking on the hospital campus so that patients and visitors can more easily find a park in the multi-storey car park. Madam Speaker, between August and December 2021, the focus shifted to the site of the new Critical Services building with the demolition of Buildings 5 and 24. The Critical Services building will deliver a new intensive care unit, more state-of-the-art operating theatres, a new acute cardiac care unit, a bigger and better emergency department and more medical imaging facilities, inpatient beds and ambulance bays. The new intensive care unit will continue to build on the increased capacity that has been provided on the current ICU at Canberra Hospital through the ICU expansion. In the 2021-22 budget, we've taken a stepped approach to opening further intensive care beds in advance of the new ICU opening in 2024. The Critical Services building will deliver 22 new operating theatres that include state-of-the-art hybrid and interventional radiology theatres. We're incorporating the latest advances in medical technology to enable even more surgeries and procedures for the Canberra community. The new acute cardiac care unit will include 32 acute cardiac care beds, 3 cardiac catheterisation laboratories and a cardiac day unit to support the cardiac catheterisation labs. This will provide even more life-saving treatment spaces to the Canberra region and future-proof the care Canberra Hospital provides to patients that present with serious heart conditions. The new emergency department will have 147 spaces. This is 72 more than currently available at Canberra Hospital and will also include a separate dedicated paediatric stream. The design of the Critical Services building and the new spaces for the delivery of healthcare will ensure they are family-focused, with access to indoor and outdoor areas that promote relaxation, quiet reflection, and the opportunity to gather with loved ones. Internal spaces and courtyards are being co-designed with consumer representatives because we want to make sure the experiences of patients and families are centred on healing and wellbeing. Madam Speaker, a smoking ceremony conducted by Ngunnawal Elder Warren Daly in August marked the cleansing of the Critical Services Building site before demolition commenced. In November 2021, a groundbreaking ceremony marked the official start of construction, with excavations commencing for the Critical Services Building's basement and ambulance bays. In the past 2 months, we saw one of the most striking signs of progress on site yet, with the assembly of 2 tower cranes, marking the start of very visible above-ground progress as the team begins to construct the slabs that will form the new building. The tower cranes are a true symbol of the work that lies ahead and the monumental effort required to bring this hospital expansion to life. By the end of the year, we'll see the Critical Services Building dominate this site as it rises 8 storeys into the air. As construction of the physical building continues, work is ongoing to finalise the detailed design of the new Critical Services Building, both clinical and publicly accessible. Consultation with clinicians has continued during this key stage of the project, providing valuable input directly into the design development of the Critical Services Building. To date, there have been more than 300 separate user group workshops with clinicians to ensure we are progressing the needs of all users, with the clinical sign-off process for this design stage occurring progressively. At the former CIT Woden site, the team have now completed physical construction of the new prototype shed. I was pleased to visit the prototype shed for a tour ahead of the formal opening last week. Last week I visited, hasn't formally opened yet. I was able to see what the team is bringing together for user groups to experience the new spaces in the Critical Services Building. The shed is currently being fitted out with equipment, including operating theatres, imaging equipment and simulated intensive care, emergency department and inpatient rooms. This will allow our clinicians to get a feel for the facilities they'll be using in the new state-of-the-art Critical Services Building. Regular consumer workshops have also continued during the design process and are currently being used to provide valuable input into landscaping and courtyards, interior designs including the family lounge and wayfinding, which is one of the most consistent areas of feedback from consumers generally. Major Projects Canberra Multiplex will continue to hold workshops through to late 2022 as these design elements are finalised. We're also continuing to talk to the residents surrounding the construction site so that they are aware of any disruptions that might affect them, can raise any issues or suggestions and are kept up to date on the building's progress. Our local community reference group for the Canberra Hospital Expansion Project continues to meet, and regular updates are distributed to the local community through letterbox drops and online. We also continue to engage with the Garran Primary School, where students have been learning all about the construction site's 2 tower cranes and the construction industry. I understand the students really enjoyed shortlisting names that have been put to a public vote, with students engaged, names for the cranes, with students engaged from across the school, preschool and all the way through to Year 6. The students shortlisted 12 crane names, and it has been a great way to engage Garran Primary School in the work of the project as the cranes bring the building to life. The Name the Crane competition opened on the Your Say website on the 28th of March and closed on 15th of April. And I hope all members took the opportunity to promote this competition, ages to be part of naming the cranes at the Canberra Hospital Expansion. The names of our cranes, hard at work on site, will soon be announced. If you walked past the site recently, you may also have noticed the wonderful artwork that some of Garran Primary School's younger students have done, which is included on the fencing around the site. Madam Speaker, delivering big construction projects like this can be disruptive, and I sincerely thank all the local neighbours and hospital users for their patience as the work on site continues. It's always difficult to build infrastructure in areas with considerable operations already underway. That's why it was so important to relocate this project as part of the Canberra Hospital onto a part of the Canberra Hospital campus, where construction would not interrupt access to emergency treatment, surgery or inpatient care. We're minimising these disruptions as much as possible while we build this critical piece of health infrastructure that will benefit future generations. Madam Speaker, I'm pleased to report to the Assembly that the Canberra Hospital Expansion Project is leading the way in environmentally friendly practice and sustainable design. Even before the Critical Services Building goes up, the team has removed and recycled more than 94% of demolition materials collected from the building site, equating to more than 8,900 tonnes of material, including metals, concrete, brick and green waste. Our construction partners have also excavated over 15,300 cubic metres of clean soil, which has been repurposed for other projects. The Critical Services building itself is one of the first all-electric buildings of its type in Australia. Through an extensive consultation and design process, we've refined the design to boost the building's Green Star rating and support a target of net zero emissions. This is being achieved through features such as green courtyards and design that maximises the use of natural light and ventilation. As to what's still to come with this project, soon we will see Hospital Road reconfigured into separate north and south access roads to facilitate construction of the Critical Services building's new Welcome Hall and pedestrian linkages into existing buildings. This will ensure that the new building provides a more seamless experience for pedestrians and more privacy for patients using the new facility. Later this year, we're expecting construction of the building's facade to commence, and by this time next year, the floor plates of the physical building will be towering above around 8 stories into the air. The mental health short stay unit proof of concept designer has also been engaged, and design for this new unit is progressing. The fact that so much progress has been made and continues to be made on site amid the challenges of disruptions posed by COVID-19 restrictions and labour and global supply chain shortages is a testament to the skills and hard work of everyone working to deliver this project. From our staff in major projects Canberra and Canberra Health Services to Multiplex, its subcontractors and all those working with them, including the unions that are proactively engaged in ensuring workers' rights and safety are at the forefront while delivering this critical infrastructure. In parallel with construction, Madam Speaker, the ACT Government has invested more than $18 million to undertake operational commissioning work to support the opening of the Critical Services building in 2024. Operational commissioning requires an equal commitment of time, effort and planning as the physical construction brings the Critical Services building out of the ground. Operational commissioning focuses on detailed workforce planning and targeted recruitment activity for the Critical Services building, consultation on the clinical models of care, development of workforce orientation, education and training modules, selection, procurement and installation of equipment, testing equipment and training staff to operate it, and establishing inventories for consumable and pharmaceutical products. The commissioning of the Critical Services building will concentrate on the operational aspects of preparing our current and future workforce, service providers and the community for the commencement and opening of this new health infrastructure for the Canberra region. Madam Speaker, the Canberra Hospital is undergoing significant change, as it has been over the last decade and more. It's just over 10 years since the Adult Mental Health Unit opened, followed by the Centenary Hospital for Women and Children, the Canberra Region Cancer Centre and the expanded Emergency Department, to name just a few major projects delivered over this period. In December 2021, the ACT Government released the Canberra Hospital Master Plan, the blueprint for how we will continue the transformation of the Canberra Hospital campus over the next 20 years. The Master Plan builds on the ACT Government's nearly $1.3 billion investment in healthcare infrastructure over the past decade and the Canberra Hospital Expansion Project currently underway. It incorporates improvements we're already making and outlines how this work will continue into the future to meet the community's needs. Implementation of the Master Plan will transform the campus in stages and ensure the best utilisation of existing critical buildings and buildings currently under construction, such as the Critical Services building. In summary, Madam Speaker, this government is investing in growing our healthcare capacity and ensuring future generations of Canberrans and their families have access to the very best healthcare facilities. I'm looking forward to seeing this building rise over the course of the year. This $624 million project is a record investment in the future of our health system, the largest health infrastructure project since self-government. It's a key part of our plan to ensure all Canberrans have access to the health services they need when they need them.